Diabetes in pregnancy or gestational diabetes is a condition in which women without previously diagnosed diabetes exhibit high blood glucose levels. Gestational diabetes is caused when insulin receptors do not function properly. Dr. Manjeet Arora tells us why it is important to get checked for diabetes and how.
India is a diabetic capital of the world. Every 7th Indian is a diabetic. So when a woman is becoming pregnant, pregnancy is considered a pre-diabetic stage. We do not know which people are going to become diabetic because we are all at a very high risk. So pregnancy is one condition which can tell us that during pregnancy, if we detect that their blood glucose metabolism is not up to the mark or they are having abnormal glucose tolerance test, that these are the people who will later on develop diabetes in their life. We should do a diabetic screening for all our pregnant patients. So whenever a patient comes for pregnancy checkup, it is a routine to ask the history if there is any family history of diabetes in parents, grandparents or in siblings, or if the patient herself has any abnormality in the whether she has ever got her blood glucose levels checked. If the history is okay, then we recommend a glucose challenge test, in which what we do, we give 50 grams of glucose to a pregnant woman and exactly after 1 hour we check the blood glucose levels. If these levels are more than the cutoff of 140 mg%, we label the test positive and then we go for an elaborate test which is called glucose tolerance test. In this we check the fasting sugar and then we give 100 grams of glucose, and after exactly 1 hour, 2 hours and 3 hours we look for blood sugar values, and if 2 of these values are abnormal, then we label them abnormal glucose tolerance test, and then they can be managed with as gestational diabetes with multidisciplinary approach in the form of diet control, in the form of oral hypoglycemic agents, and if the need arises, with the help of insulin. We can involve endocrinologist in the care or physician in the care, and even gynecologists are well trained to manage diabetes during pregnancy. Other patients, subset of the patient which is prone for diabetes during pregnancy is people having polycystic ovarian disease, which has again become very common. 3 out of 10 people these days are having polycystic ovarian disease. These are also having abnormalities of the glucose. Why just diabetes mellitus screening and its impact on pregnancy are important? Because it can lead to abortions, it can lead to preterm delivery, it can lead to big babies, and during delivery there can be problems, and if woman is obese with big baby, need for cesarean increases and attended complications.
For more videos related to pregnancy and health, log on to onlymyhealth.com.